Welcome to Nutritional Medicine by Lab Analysis. I'm Dr. Cyrus Thomas. Today we have a good show. It's about the philosophy behind doing a simple form of blood test with urine analysis and hair analysis. It sort of gets underneath some of the underlying what are called functional tests that can cost a lot of money and don't really give you information as to what really to do. So I'm going to show you why the philosophy of doing a regular 52-item blood test, a regular 30-item hair analysis, and a 15-item urine test has so much wisdom behind it. Once these results are computer uploaded, we generate a report that's called a confidential health analysis. This is a sample report of findings where the cover page has your information. These are all of the presenting symptoms that a person might have when they begin this process. And then we do a blood test of the 52 items. You'll notice that yellow is a warning sign, red is a high risk, and blue is critical. So this person has a lot of yellows in the most current blood test that they had. Now their prior blood test was done months earlier, and it's in the prior column over here, and you notice there are a lot of reds and blues. So this person over the course of months made all of these improvements out of the red and out of the blue. That blue went to red, which is good. Those reds went to yellow. That blue even went to yellow, skipping over the red. So this was very good. So you can actually do a series of tests like this over time. Some people will do it once a year. Some people who are very sick might do it once a month. And then we do a hair analysis where we are looking at a number of heavy metals in the blood like arsenic, mercury, lead, tin. We get a lot of tin from eating foods out in restaurants. Those levels in this person's prior test went from this to this. It was very good. These yellows disappeared, that red disappeared, those blues went to red, those reds went to yellow. One of them didn't change there, so it's going to take longer to correct that. The hair analysis also does essential elements. So we're looking at the prior test in this column, and we see that things improved as we went forward in time, using a lot of chelation methods, oral chelation, to take the heavy metals out of the blood and to balance the essential elements, many of which are minerals. It's another way to look at the hair analysis. When it comes to the heavy metals, we don't want any of these to be forward. We would like all the heavy metals to be at zero. But when it comes to the essential elements, we need some of these in our body. So we're looking for them to end up in the midline. These black lines means that we don't have enough. Those mean that we have too much. Nutritional supplements are then recommended. This person has about 11 different items. The number of pills per day is over on the right. If a person has difficulty taking pills, they can reduce this amount by half and take half that amount per day. And they can do that in taking half in the morning and half in the evening. So it can actually be quite comfortable that way. When we're looking at a blood test, we have most doctors are looking at this range, the functional, including the functional highs and the functional lows within the entire OK range. We don't like to use the functional lows and highs. We have a more strict range in the center, and so we're looking for optimum health. So a lot of people will say, well, my doctor said I was doing fine. They were in the functional high or low. And in reality, they don't feel well at all and don't know why. It's because they're here or here in the green, and they should be in the white. A hair analysis works well because an artery and a vein both send off a little artery and vein into the hair follicle, which makes the shaft of the hair. So it represents what the body is trying to get rid of through the blood into the production of hair. We're going to talk about the philosophy of nutritional prescribing by lab analysis. We've got a few choices. You can you can tell your symptoms to your doctor, you can fill out a questionnaire, you can do muscle testing, you can take the opinion of one doctor and they say, well, I think you need to take some CoQ10 and some L-carnitine and whatnot for your condition, and it's based on that practitioner's performance or experience in the past. I like to do a lab analysis by using a system. Let's read this together. Many doctors test blood and urine. Few test the hair or the stool for parasites. Most, when testing the blood, order 20 to 30 individual tests in the overall test. We measure 52. And to those 52, we often add hormone panels and cancer markers for early detection. We also order 30 elements in the hair analysis. This is important, for it is the most economical way to measure for heavy metals in the body and to get an overview of mineral balance. Together with the urine analysis, we cover 108 different tests. Most patients, when they bring their blood tests to me from another doctor, there's maybe 25 elements in there. It's just not enough to get a comprehensive, holistic view of what's taking place metabolically in the body. 108 is our minimum. Still, this alone isn't enough. When most doctors receive the blood results, they are using the laboratory's ranges of normal, which are based on the last 1,000 sick people who came in for testing. That's why we're using that narrower range. We're not using the functional low, functional high. We're using a more narrow range. Most blood tests are devoid of early detection cancer markers. These cancer markers are wonderful. We'll talk about them more at the end of the show. It's a good way to pick up what might be moving towards cancer or tumor formation in the future, and we're getting it early. We don't wait for the formation of a tumor before we start testing markers. Our results pass through a central computer in Dayton, Ohio, and are compared to the results of hundreds of other doctors' patients. And those files contain information on how effective were the nutrients the other patients were prescribed. So in other words, your blood tests are not only compared with those of other people, they're compared with the results those other people got taking certain nutrients. So the nutrients themselves begin to develop a track record with these people. Armed with this potent information, 108 plus tests, stringent healthy ranges, and a comparison with many other patients, we alter the recommendation to fit you specifically. After all, the computer in Ohio hasn't spoken to you and doesn't understand all your history and particular needs. And this is only the beginning of the wisdom behind this confidential report. In acute cases, we retest in 2 months. For chronic cases, we wait 4 to 6 months. When we retest, the lab values from the previous test are moved over to the right on the report into the prior column. I showed you that. The new values appear in parallel next to the prior values, and all values are color-coded: yellow for warning, red for high risk, and blue for critical. A comparison and progress is made and is seen instantly. Heavy metal values drop, minerals rebalance, and organ function begins to return to normal. Any values not dealt with adequately will be dealt with in a new way, as a new recommendation for nutritional medicines will be prescribed. So essentially, I don't know of a better way of doing this than the way this is being done. If I said, well, in 30 years, we'll be able to compare with this. We'll be able to compare results over time. It'll all be computerized. Well, here it is. It is right now at a state-of-the-art point, and it's just fabulous, but very few people are really taking advantage of it. Again, we're looking for colors to change. This is scientific. This is objective evidence that what we did actually worked and made a result. Now, what's in this? We're only showing one prior column, but if a person has had 6 tests over the last year, they would all appear in parallel to this, and we would see all of the progress. So the key points to what I've said so far are that many more tests are ordered than by regular doctors, including cancer markers. 2, our ranges for normal are more stringent, a healthy range is created. 3, the lab results are compared with those of other patients and also with the results that the nutrients prescribed for them were able to obtain. And 4, follow-up studies are compared side by side and all results are clearly seen and marked. So if you were to design a better system, could you? I don't think I could. Results speak for themselves, however. So it's not just the blood levels and the numbers getting better. The patient actually has to feel better through this process. Results speak for themselves. You are welcome to visit my website and read the case examples for more detail on our success at www.sanfranciscohomeopathy.com. And then there's a tab for blood analysis, which has a lot of information. There are also case histories there. Nothing in a blood test compares to a hair analysis for understanding the level of heavy metals in the body, the free radicals, and the mineral balance. 30 items. How would you know if you have to remove these toxins with oral chelates without this test? How would you know how far off of optimal levels the minerals are? Oral chelates work better than intravenous chelation therapy and at 1/10 the cost. You know, intravenous therapy is where you sit in a chair, you have an intravenous hookup, and you sit and a chelating substance, often a chemical called EDTA, is dripped into the blood, and it joins onto these heavy metals and allows you to urinate them out of the body. Well, it's costly and it takes 3 hours a session. With oral chelates, you just include them with your vitamins, minerals, amino acids, enzymes, and you take them in the morning, you take them in the afternoon, and they're working all day and all night, 24/7. It makes a whole lot more sense to do it that way. The hair contains an aggregation of heavy metals that can be tested economically. It also contains minerals and essential elements like copper, chromium, iodine, sulfur, and iron, 22 essential elements. It tests for 17 heavy metals like arsenic, lead, mercury, tin, and aluminum. A blood test alone will miss this completely. Here also shows us essential elements. In addition to copper, chromium, iodine, and sulfur, we measure for magnesium, zinc, manganese, lithium, cobalt, and iron, to name a few. These essential elements can be too high or too low in the hair. They must be rebalanced in an exact fashion. How could you expect to enter a health food store with 1,000 products in front of you and know which 6 to 10 are right for you? And do you think the assistant in the aisle knows which ones you should buy? I don't think the assistant is going to know. Nutrition is a complicated area these days. We walk into a store, there are so many things to buy. There are so many different types of calcium that can be bought. Calcium lactate, calcium citrate, crystallized calciums, calcium carbonate. That's probably the worst of them all. You need to talk to somebody who is up on this literature and is watching the data. I even tape Dr. Oz to watch later in the evening because as showy as the program is, it still helps to keep me up to date. He has Deepak Chopra on as a guest. He has exercise physiologists, oncologists. He has Andrew Weil on to talk about nutrition. It's actually been a good way for me to relax and keep up to date on things by watching a little TV. Blood testing. When anemias are suspected, a complete blood count is necessary. It tells you if there are enough red blood cells and if each red blood cell has enough of the oxygen-carrying hemoglobin. It tells you if the white blood cells are fighting an infection and which type of white blood cell is doing the work, which indicates the type of infection. When liver enzymes escape into the blood and get measured in a lab test, we know too many liver cells are being destroyed. The liver needs support in this scenario. When muscle cells release a different kind of enzyme, when the muscle cell breaks down, we suspect protein deficiencies, low-grade inflammation, and malnutrition or malabsorption issues. The thyroid regulates the rate at which we burn glucose, even at rest. Thyroid hormones tell us about the body's energizer, the thyroid cells that make thyroid hormones. We also look at substances the kidney filters to make sure they are being filtered out. We look at the products of bile formation to know that fats are being emulsified and that the bile is being recycled. So let me recap here. When we do a blood test, we're looking at what enzymes might be being released by different cells that are breaking down, such as muscle or liver cells. We're looking at thyroid hormones. We're looking at what the kidney can filter out. We're looking at the white blood cells to see if they have proliferated, which means they're fighting an infection. We looked at the different types of white blood cells, the polymorphonucleocytes, neutrophils. We look at the monocytes, neutrophils, because we need to know what kind of infection we're looking at. Maybe it's an allergy that's taking place in the blood. The philosophy of proper testing. It's important when going over your lab tests that you don't fixate on just one or two particular annoying symptoms and then choosing nutrients to deal with them and end up ignoring the big picture. What I call this is the shotgun approach to nutrition. People come in, they say, well, I've been seeing a nutritionist for 20 years and, I've done this and I've tried that and I've tried all these things, but I still have these problems. And I say, well, you've been sort of like throwing nutrition at your problems, different ones at different times. Why not do a comprehensive nutritional approach and treat all of them at the same time with the substances they need to make what they normally make? So for example, if the thyroid isn't doing well, it's not making enough thyroid hormone, do we want to take a synthetic thyroid? Do we want to take even a natural thyroid hormone? No, we want to improve the health of the thyroid gland so that it can make its own thyroid hormones. In other words, we don't do functional testing to see what kind of replacement therapy we could do. Replacement of sex hormones, replacement of thyroid hormones. We can give precursors, which are the molecules that turn into hormones. Giving those is a type of therapy where you're not encouraging the body to make the final product itself. When you give a precursor, you're actually doing a replacement therapy. That's what functional testing does. It leads to thinking in terms of replacement therapy. This approach leads to covering the underlying problem. It's called the back to basics philosophy of holistic alternative care. The liver cells perform 500 chemical functions. When many of those functions that were not performing properly due to vitamin, mineral, and enzyme deficiencies, and also because of interference by heavy metals and free radicals, when that's taking place, the body will begin to heal itself in miraculous ways. It's covering the bottom line. This bottom line is all too often ignored. True naturopathic cures lie in understanding the deeper reason for what is causing other malfunctions. It's getting to the bottom of things. This is a scientific approach to alternative integrative healthcare. It is a holistic and naturopathic, an approach, while at the same time using the best modern medical evaluation has to offer. It's not using the best that pharmacology has to offer, because those usually cover-ups. We're using the best that medical evaluation or diagnosis has to offer, and then we're treating medically with nutrients instead of with pharmaceuticals. Here are some frequently used tumor markers. Carcinoembryonic antigen, CEA, is an indicator of many different types of cancers. CA2729 is used mostly for breast cancer. CA199 is for breast cancer also. Prostatic specific antigen is used, of course, from prostate cancer. That's a controversial test, and discuss it with your doctor before you order it, because it's really not as clear as we'd like it to be. CA125 is great for ovarian cancer, pancreas, liver, and other pathologies. But remember, tumor markers are not always used to screen for cancer, but they do indicate some pathology. So even if you have a positive on some of these cancer markers, it doesn't mean that you have cancer. It does most likely mean that you are producing cancer cells, as we all do every day, 24/7, and your immune system is not removing them. Cancer cells are sort of retarded cells. The DNA didn't evolve properly in the cell doesn't know what its specific job is, and they sort of like, they're dumb, and they're going around in the blood not knowing what to do. They're in the way, they shouldn't be there. The immune system should phagocytize them, gobble them up, destroy them, and get rid of them. When that doesn't happen, they begin to increase in number, and eventually you form a tumor. So it's good to catch these in advance and see what's going on in the body. If you're willing to fight for your life, why bring a full load of unknown side effects when you can work on reviving your formerly healthy, cancer-fighting body? We don't take people off their pharmaceuticals. Instead, we say, do a nutritional approach that makes you start to feel better. Once you feel better, you will want to reduce your medications, because it'll be a natural consequence of feeling better. And then you can negotiate with your allopathic practitioner who prescribed those pharmaceuticals for you to begin a reduction. And eventually, most people can actually be completely pharmaceutical free. Everyone has cancer cells. Let your body be strong enough to fight those cancer cells off before you have tumor formation, and that tumor starts to occupy too much space. Cancer is a space-occupying disease. If it takes place on the inside of your thoracic cavity or inside your cranium, as it grows, it pushes other items out of the way. Those other items have nowhere to go. So essentially, those brain cells are just compressed and they die. And a brain tumor is a very hard way to go. If the tumor takes place on the surface of your body, sometimes they will grow to massive sizes. We see this in foreign countries. There was one fellow who had his, I believe it was a 190-pound tumor in a wagon that he carried along with him. It grew off of his side of his body, and he kept it in a wagon. He didn't have money to have it removed, in Africa somewhere, I believe. So space-occupying lesions or cancers push other tissues out of the way. They push on nerves. It causes a lot of pain. But cancer is not the tumor. The tumor is just an aggregation of hundreds of millions of cells that have all grown in the same area. The body is losing the battle with being able to phagocytize them. This is my office at Optimum Health Clinic, by the way. This is a code of honor written by Van Merkel, a chiropractor that I like to read. It is a great honor, an awesome responsibility, humbling. When a patient comes to me, I'm truly honored that they have come. I must do my best to deserve this honor each time I see them and in everything I do for them, for they have entrusted me with their most valuable possession, their health or their child's health. I must not be disturbed in my consultations, reports, or duties to them. I will not order one test or recommend one vitamin more than is necessary, but neither shall I shirk from my duty to tell the truth and recommend what I know, to the best of my ability, and what is required to help them achieve their goal in health. For without health, how can one fulfill their optimum potential or purpose in life? So when we think about it, there are 5 things we need to master in life. Those 5 things are spirituality, relationships, health, vocation, and money. Most people never get the money part. They don't think that's a big thing, but it really is. It causes a lot of stress. Well, the funny thing about those 5 is that the health one has to be there for the other 4 to work. It's kind of the bottom line. When you're unhealthy, you can't work. You have to stay home. You're bedridden. Other people have to take care of you. It's hard to do your meditation. It's hard to keep your financial life together. You can't have a vocation. You don't have a job anymore. And your relationships will suffer in a way because of your lack of freedom and mobility. However, there is an interesting aspect to cancer. It usually brings people together. It usually gets people to tell the person who has the cancer that they really love them. It gets the person who has the cancer to tell their family members, I love you. So it really has quite a purpose. All disease actually has purpose, and there's a new homeopathic book that's out just recently that talks about the beneficial effects of many different diseases. For example, tuberculosis killed a lot of people, but it also was a disease that makes a person quite creative. So much of our classical music came from people who were affected by TB. And there are things to say about many different diseases, but I'll leave you to get the homeopathic book. I hope you've enjoyed our program. We've brought you programs on parasites. We've done today philosophy. We've done cancer, dedicated a show to cancer, even though I talked about it a lot today. We've dedicated a show to diabetes, another one to cardiovascular health, and in the future we'll be doing thyroid, endocrine glands, and hormone production. We'll take a look at just issues of toxicity. And so, yeah, a lot of things. Hope you've enjoyed watching us. Stay tuned. We're on Tuesday nights at 8 p.m. And for people at a distance, they can see us on the internet at www.cmcm.tv. And then you go to the Watch tab and Community TV, but it has to be done on Tuesday nights at 8 p.m. Pacific time. Thank you for watching, and may you be in good health.